Question 1. Safe and effective care environment. Topic: Delegation and supervision. As a registered nurse, Sarah is assigned to oversee a team of nursing assistants NAS on a busy surgical unit. One of the NAS is inexperienced and has been struggling with taking vital signs accurately, especially blood pressure readings. Sarah is aware that there is a pressure to maintain high patient turnover, but she needs to ensure that patient safety is not compromised. Considering the principles of delegation, what is the most appropriate action Sarah should take? A. Delegate the responsibility of taking blood pressure readings to the least experienced nurse to help them learn. B. Direct the nursing assistant to continue performing the task and only intervene if the readings are significantly abnormal. C. Have the nursing assistant observe a more experienced nurse performing the task and then delegate it back when they feel confident. D. Remove the task of taking vital signs from the nursing assistants responsible until they have demonstrated proficiency. Answer: D. Remove the task of taking vital signs from the nursing assistant's responsibility until they have demonstrated proficiency. Explanation: according to the guidelines for safe and effective delegation, nurses should delegate tasks based on the competency of the team member and the complexity of the task. In this scenario, Sarah should not delegate the task of taking blood pressure readings to the inexperienced nursing assistant until they have demonstrated proficiency in this task. This is essential to ensure patient safety and to avoid errors in measurement that could impact patient care. The National Council of State Boards of Nursing (SEN) emphasizes that delegation must prioritize patient safety and the skill level of the delegatee. Inexperienced staff should not be tasked with procedures that could compromise care quality. Monitoring and supervision are crucial when delegating tasks to ensure competence. Question 2. Physiological integrity. Topic: Pharmacological and parenteral therapies. James, a 45-year-old male with a history of hypertension, has been admitted for an acute myocardial infarction. He is prescribed drone and nitroglycerin as part of his treatment. As a nurse, you are responsible for monitoring the patient during this therapy. Which of the following is a critical assessment to make before administering drone and nitroglycerin? A. Checking for any signs of active bleeding or coagulation disorders. B. Ensuring the patient is not experiencing any symptoms of hypoglycemia. C. Verifying that the patient's blood pressure is within safe range for administration. D. Ensuring the patient has history of gastrointestinal issues, as nitroglycerin can cause nausea. Answer: C. Verifying that the patient's blood pressure is within safe range for administration. Explanation: nitroglycerin vasodilator is commonly used to treat acute myocardial infarction by reducing the heart's oxygen demand. However, it can cause significant hypotension, especially when administered intravenously. Before administering nitroglycerin, it is crucial to assess the patient's blood pressure to ensure it is within safe range. Medication: if the patient's blood pressure is already low, administering nitroglycerin could result in dangerously low blood pressure, potentially leading to shock or other complications. Monitoring vital signs, especially blood pressure, is a critical step to ensure the safe administration of Roman nitroglycerin. Signs of hypoglycemia or gastrointestinal issues, while important to monitor, are not the primary concern in this specific situation. Question 3. Psychosocial integrity. Topic: Crisis intervention scenario. Question: Mr. Thompson is a 60-year-old man who has been admitted to the hospital after a stroke. He has shown signs of confusion and difficulty speaking, and his wife, Mrs. Thompson, is visibly distressed and struggling to cope. She has started to cry uncontrollably and is becoming increasingly anxious, stating that she is unsure of how to care for him at home once discharged. As his nurse, how should you respond to Mrs. Thompson's emotional state? A. Ignore her distress, as the main priority is focusing on Mr. Thompson's immediate medical needs. B. Tell her to take deep breath and reassure her that everything will be fine. C. Acknowledge her anxiety, provide support, and offer information on available counseling and support services. D. Advise her to speak to a social worker as soon as possible without engaging in further conversation. Answer: C. Acknowledge her anxiety, provide support, and offer information on available counseling and support services. Explanation: crisis intervention involves recognizing and responding to emotional distress in a supportive and compassionate way. In this scenario, Mrs. Thompson is experiencing acute anxiety and distress, which is a normal response to the stress of her husband's medical condition. It is essential to acknowledge her feelings, emotional support, and offer practical solutions, such as information on counseling and available community support services. Nurses are often the first point of contact for patients and families in times of crisis, and it is part of the nurse's role to listen empathetically and connect the family to necessary resources. Simply telling her everything will be fine, or ignoring her distress, would not address the emotional needs of the family. Additionally, evolving social worker is important. It is equally critical to engage with the family directly, offering support during the initial crisis. Question 4. Safe and effective care environment. Topic: ethical and legal issues. Julia is a registered nurse working in the emergency department. A 16-year-old adolescent without a parent or guardian present arrives at the hospital after a motor vehicle accident. The patient is alert and oriented but requires immediate treatment for a head injury. The adolescent expresses that they do not want their parents to be contacted, citing fear of into trouble. As a nurse, you must navigate the legal and ethical considerations regarding the adolescent's treatment. Which of the following should you do first? A. Proceed with treatment without notifying the parents, as the adolescent is capable of making decisions regarding their health care. B. Contact the adolescent's parents immediately to ensure informed consent is obtained before treatment. C. Assess the adolescent's ability to provide informed consent based on their cognitive ability and the nature of the treatment. D. Delay treatment until the adolescent's parents can be contacted, as parental consent required regardless of the adolescent's wishes. Answer: C. Assess the adolescent's ability to provide informed consent based on their cognitive ability and the nature of the treatment. Explanation: in this situation, the nurse must consider both the legal and ethical implications of treating minor without parental consent. While generally minors require parental consent for treatment, there are exceptions based on the minor's capacity to understand their condition and the urgency of the treatment required. Must assess whether the adolescent is mature enough to make an informed decision regarding their care, known as mature minor doctrine, and whether the situation requires immediate intervention. In emergency situations, such as head injuries, care may proceed under implied consent if the patient is unconscious or unable to provide consent, or the patient may be treated based on their expressed wishes, provided they are capable of understanding the treatment. Important to assess the adolescent's cognitive ability to ensure that their refusal is informed and valid before proceeding with care. Question 5. Health promotion and maintenance. Topic: prevention and early detection of disease. A 42-year-old female patient is in for her routine checkup. She has a family history of breast cancer, with her mother diagnosed at age 50. The patient expresses concern about her risk of developing breast cancer and is asking about screening. She has no noticeable signs or symptoms, but is considering genetic testing to evaluate her risk. You address her concern about breast cancer screening. A. Recommend that she begin mammography screening every year, starting immediately, due to her family history of breast cancer. B. Advise her to undergo genetic testing immediately to assess a risk of developing breast cancer. C. Recommend regular mammograms starting at age 50, as this is the general guideline for breast cancer screening. D. Explain the benefits and limitations of genetic testing and advise her to start mammogram screening at 40 based on her family history. Answer: D. Explain the benefits and limitations of genetic testing and advise her to start mammogram screening at age 40 based on her family history. Explanation: the American Cancer Society recommends that women with a family history of breast cancer start regular mammograms at age 40. However, this patient is at an increased risk because of her family history, and the nurse should provide information on both the benefits and limitations. Genetic testing is an additional tool to assess a risk. While genetic testing can provide more personalized risk assessment, it is not typically a first step unless there are indications of specific genetic mutations, such as ERA. Therefore, it is appropriate to recommend screening with mammograms starting at age 40, as this aligns with the guidelines for women with a family history of breast cancer. Genetic testing should be considered, should not replace routine screening. Question 6. Psychosocial integrity. Topic: coping mechanisms and defense mechanisms. Mark, a 28-year-old man, has recently been diagnosed with chronic back pain due to a herniated disc. He has become withdrawn and refuses to discuss his pain with his healthcare team. Mark frequently deflects questions about his condition by making jokes and minimizing the impact on his life. He tells his physical therapist that his condition is a big deal despite being prescribed pain medications. Which of the following defense mechanisms is Mark exhibiting? A. Projection. B. Denial. C. Repression. D. Rationalization. Answer: B. Denial explanation. Mark is using the defense mechanism of denial. Denial is a psychological defense mechanism where an individual refuses to accept reality or facts related to a distressing situation. In this case, Mark minimizes the impact of his chronic pain and downplays the seriousness of his condition by making jokes and claiming it's no big deal. By denying the severity of his pain, he avoids confronting the reality. Is diagnosis, which can hinder appropriate treatment and coping strategies. Denial can sometimes be adaptive in the short term, but over time, it can interfere with effective coping and treatment. The nurse must recognize the signs of denial and provide appropriate support, encouraging Mark to address his condition honestly to ensure effective pain management. Question 7. Physiological integrity. Topic: endocrine disorders, diabetes management. Elena, a 56-year-old woman with type 2 diabetes, has been hospitalized for uncontrolled blood sugar levels. She has been on oral medication for several years, but her blood glucose has not been well controlled. The physician orders insulin therapy in addition to her oral medication. Elena expresses concerns about using insulin, stating that does not want to rely on injections. As the nurse, how should you respond to Elena's concerns regarding insulin therapy? A. Insulin therapy is only for people with type 1 diabetes, so you should suggest alternative treatments for her. B. Explain that insulin therapy is commonly used in type 2 diabetes when oral medications are no longer effective and can help prevent long-term complications. C. Tell Elena that insulin therapy is temporary and she should try to manage her blood glucose levels with diet and exercise instead. D. Reassure her insulin will solve her problem immediately and no further lifestyle changes will be necessary. Answer: B. Explained that insulin therapy is commonly used in type 2 diabetes when oral medications are no longer effective and can help prevent long-term complications. Explanation: insulin therapy is commonly used for individuals with type 2 diabetes when their oral medications are not sufficient to control blood glucose levels. While it is more frequently associated with type 1 diabetes, many individuals with type diabetes eventually require insulin as their condition progresses. It is crucial for the nurse to provide clear and factual information about the role of insulin in managing diabetes and preventing complications such as diabetic neuropathy, kidney disease, and cardiovascular problems. Reassurance that insulin can improve control over blood glucose levels alongside a balanced approach that includes diet and exercise will help Elena understand the importance of this therapy. Denying insulin use or downplaying its role in diabetes management would be incorrect. Question 8. Clinical judgment and decision-making. Topic: prioritization and decision-making models. Maria, a 34-year-old woman with a history of chronic asthma, presents to the clinic with shortness of breath, wheezing, and a persistent cough. She reports increased use of her rescue inhaler and has been feeling fatigued for the past several days. The nurse assesses the following patients in the clinic. Patient A, a 60-year-old man with a history of diabetes presenting with chest pain and diaphoresis. Patient B, a 30-year-old woman with a U presenting with dysuria and fever. Patient C, a 45-year-old woman with a history of hypertension presenting with a headache and blurred vision. Which patient should the nurse prioritize for immediate assessment and intervention? A. Patient E was a chest pain and diaphoresis. B. Patient B, dysuria and fever. C. Patient C, headache and blurred vision. D. Patient Maria, shortness of breath and increased asthma symptoms. Answer A. Patient equals chest pain and diaphoresis. Explanation: in prioritization, the nurse must assess which patient requires the most urgent intervention. Chest pain, especially when combined with diaphoresis, sweating, raises concerns for a potential myocardial infarction or acute coronary syndrome (ACS). This condition is life-threatening and requires immediate assessment and intervention to prevent further complications such as cardiac arrest. Although asthma exacerbations can also be serious, they typically do not present with the immediate life-threatening urgency of a heart attack. Dysuria and fever, patient B, and headache with blurred vision, patient C, are also concerning, but they do not present the immediate critical threat of a cardiovascular event. Prioritizing based on the severity of the potential condition is essential in providing safe and effective care. Question 9. Professional roles and responsibilities. Topic: nursing practice and standards. During a routine shift, Maria, a registered nurse, observes a nursing assistant not reusing a syringe to administer medication to a patient. The now insists that it is acceptable to do so since the patient is stable and the syringe was not visibly contaminated. What is the most appropriate action for Maria to take in response to this situation? A. Discuss the situation with the now. Explain the importance of following infection control protocols and report the incident to the supervisor. B. Ignore the situation as the patient is stable and the risk of infection is minimal. C. Report the incident immediately to the State Board of Nursing for failure to comply with safety standards. D. Advise the NUT to continue with their task but ensure they properly clean the syringe before reuse. Answer A. Discuss the situation with the NUT. Explain the importance of following infection control protocols and report the incident to the supervisor. Explanation: reusing syringes is a serious breach of infection control protocols and can lead to serious consequences, including cross-contamination, infections, and transmission of bloodborne pathogens, according to the Centers for Disease Control and Prevention (CDC) and infection standards. Syringes should never be reused. Maria, as the responsible RN, has an obligation to intervene immediately to ensure the safety of the patient. She should discuss the situation with them, educate them about the importance of adhering to infection control practices, and report the incident to the supervisor to ensure the appropriate corrective action is taken. Ignoring the situation or allowing unsafe practices to continue would compromise safety in the nurse's legal and ethical responsibilities. Question 10. Health promotion and maintenance. Topic: maternity and pediatric nursing. A 27-year-old woman who is 32 weeks pregnant presents to the clinic for her routine checkup. She reports feeling lightheaded, especially when standing up, and has had occasional swelling in her feet and hands. She has no significant medical history, but she is concerned about the symptoms she is experiencing. Based on her presentation, what would be your likely assessment and recommendation? I advise the patient that lightheadedness and swelling are common during pregnancy and there is no need for further testing. B. Recommend that the patient increase her fluid intake and reduce sodium intake to alleviate swelling. C. Perform a thorough assessment of her blood pressure and check for signs of preeclampsia, as these could be symptoms of the condition. D. Suggest that the patient rest more and avoid standing for prolonged periods to reduce her symptoms. Answer: C. Perform a thorough assessment of her blood pressure and check for signs of preeclampsia, as these could be symptoms of the condition. Explanation: swelling in the feet and hands, along with lightheadedness, can be common during pregnancy, but they may also indicate preeclampsia, a potentially dangerous condition characterized by high blood pressure and organ damage, and usually occurring after 20 weeks of gestation. The nurse should perform a thorough, including checking the patient's blood pressure and looking for additional signs of preeclampsia, such as protein in the urine, headaches, or visual disturbances. If preeclampsia is suspected, the nurse should report the findings to the physician immediately for further evaluation and management. Simply attributing the symptoms to normal pregnancy changes without further assessment could put the mother and baby at risk. Preeclampsia requires timely intervention to prevent complications like eclampsia, premature birth, or maternal organ failure. Question 11. A 56-year-old male patient with a history of hypertension and type 2 diabetes presents to the emergency room with complaints of chest pain radiating to his left arm. He also reports shortness of breath, nausea, and diaphoresis. The physician orders an ECG and cardiac biomarkers. The nurse should prioritize which of the following actions in managing this patient's care. A. Administer stat dose of aspirin and morphine as prescribed. B. Obtain full health history to assess for additional cardiovascular risk factors. C. Prepare the patient for possible coronary artery bypass graft (CAG) surgery. D. Reassure the patient that the symptoms are likely related to indigestion. Answer A. Administer a stat dose of aspirin and morphine as prescribed. Explanation: the patient's symptoms, chest pain, shortness of breath, nausea, and diaphoresis, are indicative of potential acute myocardial infarction. Immediate interventions include administering aspirin to reduce platelet aggregation and morphine to alleviate pain and reduce anxiety. This is consistent with the monoprotocol morphine, oxygen, nitroglycerin, aspirin for OMI management. While obtaining full health history and preparing for surgery may be necessary later, the priority is to stabilize the patient and manage the acute symptoms. Reassuring the patient that the symptoms are related to indigestion would be inappropriate and dangerous. Question 12. Mr. Thompson, the 72-year-old male, has been admitted to the hospital following a stroke that resulted in left-sided hemiplegia. The nursing team has created A care plan focused on improving his mobility and strength. Which of the following interventions should the nurse prioritize to prevent complications associated with immobility? A. Encourage Mr. Thompson to perform deep breathing exercises hourly. B. Position the patient in a low Fowler's position to facilitate drainage. C. Reposition Mr. Thompson every 2 hours and provide passive range of motion exercises. D. Offer Mr. Thompson a high-protein diet to help improve muscle mass. Answer: C. Reposition Mr. Thompson every 2 hours and provide passive range of motion exercises. Explanation: Repositioning every 2 hours is essential to prevent pressure ulcers and reduce the risk of complications such as contractures and deep vein thrombosis (DVT). Providing passive range of motion exercises is also crucial to maintain joint flexibility and improve circulation, especially in patients with hemiplegia. While deep breathing exercises are helpful for improving respiratory function, the immediate priority is preventing complications associated with immobility. A high-protein diet is beneficial for wound healing and muscle mass, but is not the most immediate intervention for immobility. Question 13. A 24-year-old female with a history of anxiety and depression presents to the clinic seeking advice on starting a new medication prescribed by her psychiatrist. She expresses concerns about the potential side effects of the medication, particularly its impact on her ability to concentrate. Which nursing intervention is most appropriate in this situation? A. Encourage the patient to seek a second opinion from a different psychiatrist. B. Educate the patient about the importance of taking the medication as prescribed and provide information about common side effects. C. Recommend a different medication with fewer side effects without consulting the psychiatrist. D. Advise the patient to stop taking the medication if she experiences any side effects. Answer: B. Educate the patient about the importance of taking the medication as prescribed and provide information about common side effects. Explanation: the nurse's role is to support the patient by providing education about the medication prescribed, including potential side effects. It's important to reassure the patient that some side effects like difficulty concentrating may diminish over time and explain the importance of adhering to prescribed treatment. Stopping the medication or seeking a second opinion should not be the nurse's first recommendation, unless there are serious concerns about the medication's safety. Additionally, recommending different medication without consulting the prescribing psychiatrist is beyond the scope of nursing practice. Question 14. A nurse is caring for a patient who has been admitted for acute pancreatitis. The nurse notes that the patient's serum amylase and lipase levels are elevated. The patient reports severe abdominal pain, nausea, and vomiting. Which of the following actions should the nurse take first? A. Encourage the patient to drink fluids to rehydrate. B. Administer pain medication as prescribed. C. Assess the patient's vital signs and perform an abdominal assessment. D. Prepare the patient for potential cholecystectomy. Answer: C. Assess the patient's vital signs and perform an abdominal assessment. Explanation: acute pancreatitis is an inflammatory condition of the pancreas often caused by alcohol use or gallstones. The priority intervention is to assess the patient's vital signs and perform an abdominal assessment to evaluate the severity of the condition and check for signs of complications such as shock or peritonitis. Pain management is important, but assessment should be performed first. Hydration is also important, but fluid administration should be done cautiously and under the guidance of healthcare provider. Cholecystectomy would be considered if the cause of the pancreatitis is gallstones, but it is not the first step. Question 15 scenario. Mrs. Garcia, a 58-year-old woman, has just undergone a mastectomy. She is recovering well physically, but she is showing signs of anxiety and emotional distress. Mrs. Garcia states, "I don't know how I will cope with this. I feel like part of me is missing." The nurse notices that she is avoiding looking at the surgical site and seems withdrawn. Which response by the nurse would be most appropriate to address her emotional needs? A. I understand that this is a difficult time for you. You should be more positive and focus on recovery. B. I'm sure you're feeling devastated, but in time you will adjust. Let me know if you need anything. C. You are going through a lot right now, and it's okay to feel how you feel. Would you like to talk about your concerns? But D. You need to start thinking about moving forward and not dwell on the past. Correct answer, C. You are going through a lot right now, and it's okay to feel how you feel. Would you like to talk about your concerns? Explanation: the nurse should acknowledge the patient's emotional state and validate her feelings. Providing empathetic responses that encourage the patient to express her concerns fosters therapeutic communication and supports emotional well-being. Telling the patient to be positive or to move forward too quickly may invalidate her feelings and hinder the development of trust. Offering an open space for discussion and ensuring that the patient feels heard is crucial in helping her cope with the emotional challenges of recovery after surgery. Question 16. A patient with chronic kidney disease (CKD) is being prepared for discharge. The nurse is reviewing the patient's dietary restrictions and fluid intake. Which statement by the patient indicates the need for further teaching? A. I will avoid eating foods high in potassium, like bananas and tomatoes. B. I can drink as much fluid as I want because I'm feeling fine now. C. I should avoid salt and limit my sodium intake to control my blood pressure. D. I should take my medications as prescribed and follow up with my healthcare provider regularly. Answer: B. I can drink as much fluid as I want because I'm feeling fine now. Explanation: patients with CKD often need to restrict their fluid intake to prevent fluid overload, which can lead to complications like hypertension, edema, and heart failure. Even if the patient is feeling fine, it is essential to adhere to the prescribed fluid limits. Educating the patient about managing their fluid intake and monitoring for signs of fluid retention is crucial. The other statements about avoiding high potassium foods, limiting sodium, and adhering to medication and follow-up care are correct practices for managing E. Question 17. A nurse is caring for a 45-year-old woman who has just been diagnosed with type 2 diabetes mellitus. The physician has prescribed metformin, a medication commonly used to manage blood glucose levels. Which of the following teaching points is most important for the nurse to include in the patient's education regarding metformin use? A. You may experience weight gain while taking this medication, so you should monitor your weight regularly. B. Take metformin with food to prevent gastrointestinal side effects like nausea and diarrhea. C. It is important to avoid all dairy products while taking this medication. D. You will need to take this medication every day, but you do not need to monitor your blood glucose levels. Answer: B. Take metformin with food to prevent gastrointestinal side effects like nausea and diarrhea. Explanation: metformin is a first-line medication used to treat type 2 diabetes by improving insulin sensitivity. A common side effect is gastrointestinal discomfort, including nausea and diarrhea, which can be minimized by taking the medication with food. It does not typically cause weight gain, so option A is incorrect. Products do not interact negatively with metformin, so C is also incorrect. Regular blood glucose monitoring is essential for diabetes management, so option D is incorrect. Question 18. A 67-year-old female patient presents to the clinic with complaints of fatigue, weight gain, constipation, and cold intolerance. Laboratory results show elevated TSH, thyroid-stimulating hormone, and low levels. The patient is diagnosed with hypothyroidism and prescribed levothyroxine. Which of the following interventions should the nurse prioritize when teaching the patient about managing hypothyroidism? Medication. A. Take your medication at any time of day with or without food, and you can skip doses if you forget. B. Take the medication in the morning on an empty stomach and avoid eating for at least 30 minutes after taking it. C. It is important to take your medication with a meal to prevent gastrointestinal upset. D. If you experience weight loss or palpitations, you should stop the medication and notify your doctor immediately. Answer: B. Take the medication in the morning on an empty stomach and avoid eating for at least 30 minutes after taking it. Explanation: levothyroxine is best absorbed on an empty stomach, and food can interfere with its absorption. Therefore, the nurse should instruct the patient to take the medication in the morning at least 30 minutes before eating. Skipping doses or taking it at any time of day would affect the medication's efficacy, and it should be taken with food unless advised by the provider. If the patient experiences weight loss or palpitations, it could indicate over-medication, but the patient should not stop the medication without consulting the provider. Question 19. A nurse is caring for a patient who has been prescribed digoxin for the treatment of heart failure. The patient's current vital signs include heart rate of 48 beats per minute, blood pressure of 110/68 mmHg, and respiratory rate of 16 breaths per minute. Which action should the nurse take next? A. Administer the digoxin as prescribed as the heart rate is within normal limits. B. Hold the digoxin and contact the physician for further orders. C. Increase the dosage of digoxin to increase the heart rate. D. Encourage the patient to drink fluids to help increase the heart rate. Answer: B. Hold the digoxin and contact the physician for further orders. Explanation: digoxin is used to increase the strength of heart contractions but can cause bradycardia, a slow heart rate. The patient's heart rate of 48 beats per minute is below the typical threshold for safe administration of digoxin, which is generally 60 beats per minute or higher. The nurse should hold the medication and contact the physician for further guidance. Administering the drug could potentially worsen the bradycardia and lead to complications. Question 20. A 72-year-old male patient has been diagnosed with chronic obstructive pulmonary disease, COPD, and is receiving supplemental oxygen therapy at home. The patient has a history of smoking and expresses concerns about oxygen use at home. Which of the following statements by the nurse would be most helpful in educating the patient about oxygen therapy? A. You should increase the oxygen flow rate if you experience shortness of breath. B. Oxygen therapy is only needed during sleep and should not be used during the day. C. It is important to keep the oxygen flow rate as prescribed and avoid increasing it without a doctor's approval. D. You should avoid any physical activity while using oxygen to prevent worsening your condition. Answer: C. It is important to keep the oxygen flow rate as prescribed and avoid increasing it without a doctor's approval. Explanation: oxygen therapy should be administered at the prescribed flow rate to prevent oxygen toxicity and avoid respiratory complications. The patient should not adjust the flow rate without consulting the physician. Increasing the flow rate could lead to risk of oxygen toxicity, and supplemental oxygen is often used throughout the day and not just during sleep. Physical activity can still be performed while using oxygen, but they should be done under safe conditions. Question 21. A 45-year-old female patient with a history of rheumatoid arthritis (ROT) is being started on methotrexate therapy. She expresses concerns about the medication's side effects, particularly its potential impact on her liver. Which of the following interventions should the nurse include in the patient's education regarding methotrexate? 8. You will need to undergo regular blood tests to monitor liver function while on this medication. B. Methotrexate has no significant impact on liver function, so no further tests are required. C. You should stop taking the medication immediately if you experience any nausea or vomiting. D. Methotrexate is safe medication and has minimal risk of side effects. Answer: 8. You will need to undergo regular blood tests to monitor liver function while on this medication. Explanation: methotrexate is a disease-modifying antihematic drug (DMARD) that can cause hepatotoxicity, so it is essential for the nurse to educate the patient about the need for regular liver function tests to monitor for potential liver damage. The patient should not stop the medication without consulting the physician, and while side effects are possible, methotrexate is an effective treatment for RA that requires monitoring. Question 22. A nurse is caring for a patient who is receiving a blood transfusion. The patient begins to complain of back pain, chills, and fever within 30 minutes of the transfusion. What should the nurse do first? A. Stop the transfusion and administer antipyretics as prescribed. B. Stop the transfusion and notify the healthcare provider immediately. C. Continue the transfusion and monitor for further symptoms. D. Administer a pain medication as prescribed and continue the transfusion. Answer: B. Stop the transfusion and notify the healthcare provider immediately. Explanation: the symptoms of back pain, chills, and fever during a blood transfusion suggest a potential transfusion reaction, which can be life-threatening. The first action should be to stop the transfusion immediately to prevent further complications. The nurse should then notify the healthcare provider and follow the facility's protocol for managing transfusion reactions, which include administering fluids, medications, or starting different transfusion process. Question 23. A 30-year-old pregnant woman in her second trimester is admitted to the hospital with severe preeclampsia. The nurse is reviewing the lab results, which show elevated blood pressure, proteinuria, and low platelets. Which of the following is the most important nursing intervention for this patient? A. Monitor fetal heart rate and prepare for possible delivery. B. Administer antihypertensive medications and monitor for signs of eclampsia. C. Encourage the patient to ambulate frequently to improve circulation. D. Restrict fluid intake to prevent fluid overload. Answer: B. Administer antihypertensive medications and monitor for signs of eclampsia. Explanation: severe preeclampsia is a serious pregnancy complication that requires prompt intervention. The nurse should administer antihypertensive medications as prescribed to control blood pressure and monitor the patient for signs of eclampsia, which can cause seizures. While monitoring fetal heart rate is important, addressing the maternal blood pressure and complications such as eclampsia is the priority. Question 24. A nurse is caring for a pediatric patient who has been diagnosed with otitis media. The child is experiencing pain, fever, and irritability. Which of the following interventions should the nurse implement first? A. Administer antibiotics as prescribed for the infection. B. Apply a warm compress to the ear to reduce pain. C. Provide acetaminophen for pain and fever relief. D. Encourage the child to drink fluids to stay hydrated. Answer. C. Provide acetaminophen for pain and fever relief. Explanation. The child's immediate symptoms of pain and fever should be addressed first with antipyretics and pain relief, such as acetaminophen, while antibiotics may be necessary. Pain management is the priority until the infection is fully assessed by the healthcare provider. Warm compress can be helpful for pain relief, but should follow the administration of medication for fever and uninjured. Question 25. A nurse is caring for a patient diagnosed with schizophrenia who is being prescribed an atypical antipsychotic medication, clozapine. The nurse notes that the patient's white blood cell count is significantly low. Which action should the nurse take? A. Continue the medication as prescribed and monitor for signs of infection. B. Hold the medication and notify the healthcare provider immediately. C. Administer the medication with lower dosage to avoid further complications. D. Encourage the patient to increase fluid intake to help debusoproduction. Answer. B. Hold the medication and notify the healthcare provider immediately. Explanation. Clozapine has a risk of causing agranulocytosis, a potentially life-threatening condition where the white blood cell count drops significantly, increasing the risk of infection. If the patient BC count is low, the nurse should immediately hold the medication and notify the healthcare provider to assess the need for further action, such as stopping the medication, adjusting the treatment plan. Question 26. A 60-year-old male with a history of hypertension and diabetes presents with new-onset left-sided weakness and slurred speech. He is diagnosed with an ischemic stroke. The nurse should prioritize which of the following interventions? A. Administer a fibrinolytic agent within the recommended time frame. B. Encourage the patient to rest and take deep breaths. C. Administer antihypertensive medications to lower the blood pressure. D. Monitor for signs of hemorrhagic transformation and prepare for surgery. Answer. A. Administer fibrinolytic agent within the recommended time frame. Explanation. For ischemic stroke, the administration of fibrinolytic agents e.g. tissue plasminogen activator or EPA within a specific time frame, typically 3 to 4.5 hours, can help dissolve the clot and restore blood flow to the affected area of the brain. Prompt intervention is critical to minimize brain damage. Monitoring for hemorrhagic transformation is important after fibrinolytic therapy, but the priority is to treat the ischemic stroke with appropriate interventions. Question 27. A nurse is caring for a patient with a history of chronic kidney disease, CKD. He is now in the hospital for acute renal failure. The patient is receiving hemodialysis. The nurse notices that the patient has developed a fever, hypotension, and chills after the dialysis session. What is the most likely cause of these symptoms? A. Dialysis disequilibrium syndrome. B. A dialysis-related infection. C. Hyperkalemia due to potassium shifts. D. Hypoglycemia from insulin administration during dialysis. Answer. B. A dialysis-related infection. Explanation. The symptoms of fever, hypotension, and chills after dialysis are characteristic of a dialysis-related infection, which could be caused by an infection at the dialysis access site or due to contaminated equipment. Dialysis disequilibrium syndrome occurs during the initial stages of dialysis and is associated with neurological symptoms, while hyperkalemia and hypoglycemia typically present with fever and chills after dialysis. Question 28. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is prescribed oxygen therapy at home. The patient expresses concern about using oxygen while smoking. What is the best response by the nurse? A. You can smoke while using oxygen, but you should stay at least 6 feet away from the oxygen tank. B. You should avoid smoking altogether while using oxygen, as it is a fire hazard. C. It is safe to smoke while using oxygen if you do not light your cigarette directly near the oxygen source. D. You can smoke, but make sure the oxygen tank is turned off while you are smoking. Answer. B. You should avoid smoking altogether while using oxygen as it is a fire hazard. Explanation: smoking while using oxygen is extremely dangerous because oxygen can intensify a fire. The patient should be instructed to avoid smoking entirely when using oxygen to reduce the risk of fire or explosions. The oxygen tank should also be handled with care to prevent leaks or accidents. Question 29. A nurse is educating a patient with type 2 diabetes about managing their condition. The nurse discusses the importance of diet, exercise, and medication in managing blood glucose levels. Which of the following statements made by the patient indicates a need for further education? A. I should monitor my blood glucose regularly to make sure it stays within a healthy range. B. I can eat whatever I want as long as I take my insulin. C. Exercising regularly will help me control my blood glucose levels. D. I need to take my diabetes medications as prescribed by my doctor. Answer: B. I can eat whatever I want as long as I take my insulin. Explanation: while insulin is an important part of managing type 2 diabetes, it is essential for the patient to also manage their diet and exercise. Eating whatever they want without considering the impact on blood glucose levels can lead to uncontrolled blood sugar levels and long-term complications. Education should emphasize a balanced diet and lifestyle changes along with medication. Question 30. A nurse is caring for a 70-year-old patient who is scheduled for a hip replacement surgery. The patient has a history of deep vein thrombosis (DVT) and is at high risk for developing post-operative blood clots. Which of the following interventions is most important for preventing DVT after surgery? A. Administer prophylactic anticoagulation therapy as prescribed. B. Encourage the patient to remain in bed for the first 24 hours after surgery. C. Monitor the patient's blood pressure and heart rate for any abnormalities. D. Apply cold compressors to the surgical site to reduce swelling. Answer: A. Administer prophylactic anticoagulation therapy as prescribed. Explanation: the most important intervention for preventing DVT after surgery is administering prophylactic anticoagulation therapy such as low molecular weight heparin or enoxaparin. This helps reduce the risk of blood clots forming, while early mobilization and other interventions like compression stockings may be used. Anticoagulation therapy is a key prevent DVT in high-risk patients.